The Global Action Plan means hope for me. Why? Because many of the neurological disorders account for significant long-term disadvantage and reduced quality of life. And people living with neurological conditions, including Tourette syndrome, are commonly misunderstood, stigmatized, marginalized, and misdiagnosed. My hope is that the Global Action Plan is increased awareness, understanding, and united advocacy to the public, health, education, and government sectors.
I really appreciate the achievements that has been made, that we now have a global action plan for neurology, because I think that gives us, as patient advocates, a point of reference when we approach our health authorities and say, this is something the world has come together and agreed needs to be prioritized, and how can we then put this into concrete actions here in the country or in the region or wherever we are, so that it makes a difference to patients, because that's what it's really about.
I'm a TBI survivor, and as someone who had a very long recovery with very female-specific issues, which doctors and researchers had a very difficult time being able to deal with, I know how important this initiative is.
Being a parent of somebody with a neurological condition is frightening and frustrating. It always feels like neurological conditions aren't a priority and that there just isn't enough being done because they aren't life-threatening. They don't draw the research that life-threatening conditions do. Neurological conditions can be life-limiting and have a massive impact on quality of life. Having a global action plan would be amazing. A united global vision to make neurological conditions a priority is exactly what we need as a community.
Migraine is the second biggest cause of disability-adjusted life years globally, and the leading cause in young women. No other disease, communicable or non-communicable, is responsible for more years of lost healthy life in young women. Despite this, and perhaps because of its invisible nature, the severe burden of migraine is commonly overlooked. My hope is that the Global Action Plan will lead to increased prioritisation of migraine and other neurological disorders by our policymakers, with increased funding for research, improved access to treatments, and equal and timely access to specialist medical professionals for all affected.
It's important for neurological disorders to be globally recognised because it badly affects people's well-being, mental health and quality of life, and we want to get them help with that.